What matters more to me is how my face work, not how it look.
Gotcha. Okay. Um, so what we'll do is, do you have any other medical problems, like diabetes? Do you use any tobacco products?
Mm-mm.
Nothing like that? Okay. The reason I ask all that is just getting an idea of how well you heal overall. And the good thing, granted, as bad of an injury that this was, the good thing in terms of just your overall how your skin heals is you haven't developed a lot of keloid or scar tissue that's grown out of the scar. Some people,
Oh, like that puffy skin.
exactly. Some people, and usually people who have darker skin, have more melanin in their skin, they have more problems with keloid. You really don't, surprisingly. There are a lot of people who they'll get a scar, and it'll be like puffy, mature scar tissue that's growing out. Yours looks like a again significant scar that has contracted in, which is what scars do. That helps us to a certain degree because it means that if we have to make any other incisions, we're not going to create all this excess scar tissue.
Mm-hmm.
Okay.
Okay.
Now, do you have any other from your injuries? What other problems do you have that aren't related to the facial paralysis and weakness? Are you able to eat okay and able to?
Oh, it hurts sometimes when I eat.
When you move in the jaw?
Mm-hmm.
Okay.
But I just look at it as exercise.
Okay, good.
Right.
Has that helped in terms of, like, if they talked, sometimes we'll have Dwayne, who works with Dr. Green in the facial nerve clinic, work with people on helping with mouth opening, and sometimes they'll have people get essentially popsicle sticks and do these mouth stretching.
Oh, I had the sticks before.
Yeah. Didn't help too much.
No, they didn't help too much. I put them on down. I quit. I put them popsicle sticks down. Quit.
Okay. No, I don't blame you. Well, I asked that because I want to make sure that this is a tough problem to tackle, and we want to balance not making other things worse, right?
Mm-hmm.
And anything we can do that is more conservative, that will prevent us from needing to get near that nerve, is going to be a good thing. And what I'm going to do is give me a moment. I'm going to speak with Dr. Cox, tell him your story, the injuries you had. Well, I know we have those scans that they did a few days ago, and we'll look at those.
Oh, yeah, I need.
You want to look at them?
Yeah.
Yeah, let me show you. I'm going to show you kind of two different sets. They're the same ones.
Okay, go ahead.
Here, I'm going to
Get it too.
Yeah.
Okay.
I'm going to show you the ones where they do the 3D reconstruction first, because it's a little bit easier to kind of conceptualize, okay?
Okay.
So this is after your repair, okay? So this is the one that was done 3 days ago. This takes all those CT images and creates your skull based on...
That's a skull, hey.
That's your skull.
That's my skull?
Yeah.
Oh, okay.
So I'll just kind of
So
talk
this is me
through it.
looking like Skeletor.
Exactly. So this is we're looking. The way we're looking at this is as if we're looking at you straight on.
Okay.
So that's the right side. This is the left side. Okay. Now you'll see here. You kind of see those little rings right there along the underneath the right eye.
Okay.
That's gonna be right over here. That's that plate. That's the metal plate that they put in to hold those fractures together. Now
That's why they put the plate out in my face?
you have multiple plates. So
I got multiple.
So this is as if we're looking.
Wait a minute. Wait. Just slow down 1 second. Okay. Because I never asked about my plate.
Okay.
Or nothing. I never knew
Okay.
what happened. So you just kind of
I'll
took
walk
me
through-
too fast. I
I'll
thought
walk
it was
through each
one plate.
I'll walk through each one. Okay.
Okay.
So we're gonna start from the top down. I've turned the skull, so now it's like I'm looking at you right now, like looking towards the right side of your face.
Okay.
So you're kind of looking. It's like you looking that way.
Mm-hmm.
So you can see here. You see this bone here and this bone here. There's that crack there,
Mm-hmm.
and then that's a plate right there. And
So, okay.
that's one of them. So now this is the kind of your eye socket, the bony eye socket. If we go down and along the side and right below your eye, kind of where the bridge of your cheek is, there's fractures there, and this plate, this long plate, is holding those all together.
Okay.
And they're well aligned. The bone fragments are well aligned in those regions. It looks like a good result. back here, there's an arch that we call the zygomatic arch. There was a fracture. You can see it right there. That plate is holding that together. Okay, but it's healing well. The plates don't add all of the support. It's that they align the bones and keep them there so they can heal well. And that's well aligned. So that's healing well too.
Okay.
I'm going to start from the bottom now and work up. So that you had a jaw fracture too that is healing well. You can barely make it out here. You see that kind of line right there and there?
Mm-hmm.
That's the plate that was put in there to help that heal. And that's healing well. And there are other...
So, wait a minute. So, I got 4, 5 plates in?
A collection. There were a lot of separate fractures. And one plate can't address all of them.
I just never knew. Okay.
That's okay. No, it's a lot to see at once because you're seeing everything that had to be repaired, okay?
Mm-hmm.
Now, for the jaw, there's one kind of way back here that looks like it's healing well as well. And it gets complicated back here because it's all this material. It's not fractures. It's just the imaging. It's not doing all of that. So it's not like your skull stops there. And then supporting along the front part of the cheekbone here, there are plates right there. Okay?
Okay.
Overall, now I'm going to go from this to it's the same image, it's just in a different way. Let me show you. So these are the actual scans that were used to create this. This is what doctors are kind of used to looking at. And I can kind of systematically go through and show where the plates are again, if you're fine with that, just to reinforce where they are. So the white area that lights up, you can kind of see it light up this way. Mm-hmm. That's the one that's supporting right underneath the eye.
Wait a minute.
We looked at the one earlier.
Okay.
It's the one that's right there. It just looks different because instead of seeing a three-dimensional structure, we're going through these kind of one slice at a time.
Okay.
There's no difference between these two. There's not. This image is based off of these images, so there's no difference there.
That one for me, skeletal, the one I said when I thought I was going to wake up looking like a skeleton. I actually did.
Well, at least underneath all your skin and everything, it's not, this is just, if you did a scan of me and did this reconstruction, it would look pretty similar to this. Okay? That's normal. Like the overall form and structure of the skull looks pretty good given the injuries that you had. Okay? And the important part, what I want to reinforce is that, the plates were put there for a reason to help the bone heal well, and a lot of these places with fractures, the bone is healing well, and that's the important thing. That's that you've had a good result from getting those fixed. Okay.
The bone.
The bone. So, like for example, let me pull up. So this is the same scan that you had that was used to create that model, and this is as if we're taking like slices kind of this way and working our way up. So this is as if you're lying down on a bed and we're at the foot of the bed, and this is the right side and this is the left side. So this area right here is your jawbone, like the right side of it curving over to the left side. It's just a weird orientation, okay? And what I want to show you is that here you can see there's that white area right there, that bright area. That's that plate. And you see how the bone is lined up really well along that?
Yeah.
And you can see where the fracture used to be right here, but it's all lined up and healing well. So what adds the most improvement in healing and strength of the bone is the bone healing, not the plate alone. The plates keep it there. We never take the plates out, but they're there when things are healing. They keep them in one spot so you can get a result like that where the bone heals well. Okay?
Mm-hmm.
So that all looks good. Now from this point it gets a little confusing because it's just, again, it's not as easy to understand as the model, but it's all the same imaging. Okay? So our goal in trying to balance making this look better, we won't have to mess with any of the bone aspects of it. Okay? Our goal will be to see what we can do to add more bulk to this area to make a more symmetrical face. Okay?
To make it fill out, basically.
That's exactly that's ideally that's what we need to accomplish, right? Based on your goals, too. And then from that point, we could work on what can we do to make the skin overlying that area look better. And in some cases, when people have larger scars, and balancing, making sure that we're not going to do anything to hurt the nerve, sometimes you do things in steps. You take care of one problem, add a little bit of bulk, go from there. Okay? Mm-hmm. My point with that is that typically with more complicated scar revisions, we may not do everything all at once, and that's expected, and that helps us get to a better result than we would otherwise. Okay?
So let's go back to this skeleton picture of these plates.
Yeah.
So basically everything over there is like plates in different spots.
In the spots that we needed to reestablish the overall structure of your face, yes. Because you see how this bone right here has these 3 plates holding it in place? Mm-hmm. If it wasn't there, that bone would just be free floating after.
But it's a bone down there too?
Well, the bone is healed. The plates were there originally, to help it heal. The bone has healed between these areas.
So the bone healed?
Yeah.
It came back right?
Yeah.
Okay.
In order for bone to heal well after a fracture, it's like the whole reason for doing a cast. You need the bone to align well and to touch together where the fracture was. That allows it to heal.
So on that picture right there by that eye, all this is a plate too?
Which along the rim here.
Right up there.
It's not, there's bone directly underneath that, but there's a plate along that rim.
Okay.
And these are thin plates. They're about that thin. They're not huge chunks of metal. They appear more prominent because you can see them very clearly compared to the bone because they're shaped differently. Mm-hmm.
And there was I seen one up there by my temple. That's what that puffiness was, I guess.
Yeah, and
it came on down.
Exactly.
That looked like a screw.
And so the screws hold the plates in there. They're tiny screws. They're pretty small, but that's
Well, I'm glad to see it. Now I know what I look like.
Yeah. So this is a good result from getting a lot of those fractures repaired. Okay, and our goal is to continue to make things look better. Okay.
Right.
So if you'll give me a few moments, I'm going to see with Dr. Cox real quick. We'll talk about what we can do to try to improve the appearance of this and try to get some more symmetry to the face. Mm-hmm. Do you have any other specific questions for me before I speak with him and we come back?
Just make sure it's not any important for my outside. I'm just really worried about like you said, my nerves and stuff coming back, my movement.
And we want to make sure that we don't make any of that worse. I was trying to find some tissues, but here you can use this as well. And we will definitely talk about that. We do not want to rush into any surgery that would make any aspect of that worse. Okay. Mm-hmm. So give me a few moments. I'll go speak with Dr. Cox, and we'll be right back. Okay.
Okay.
Hey there.
Hey.
Art Cox.
Hey, Art Cox.
Nice to meet you.
Nice to be met.
It's good. All right, so Jake, catch me up to speed.
Well, Ms. Mixon had a fortunate injury back in March of this year, a gunshot wound to the face, and had extensive facial fractures that the head medic team helped repair. And since then, has had this. These are her latest scans a few days ago. And we were going through all of the repairs that we had done from a bony standpoint. This is the reconstruction, of course. And a lot of those we were going through, a lot of those had pretty good union and were relatively well approximated. And at the time of her injury, Dr. Green was concerned that the facial nerve on that side had been completely severed. However, she actually had a great recovery, especially of the upper division, and has still some function in the lower division. Most of the weakness right now is within the midface on that side, as you might expect. The main problem from a cosmetic standpoint is the lack of soft tissue in that area compared to the other side.
I know it's uncomfortable, but I gotta stare at you a little bit.
Okay.
I'm listening to you.
Yeah. Other than that, the main discussion we had is talking about options, is making sure that anything that we did wouldn't risk further damage to the facial nerve, and it's in an area kind of relatively high real estate for that, especially with the upper division.
Is that why it was tender?
Not necessarily the sensation of it, but I know Dr. Green had spoken to you about where that scar is near some of the branches that control the upper part of the face right here. And I know we were just talking about making sure that anything we would do wouldn't put that at risk, because we talked about how much the face working matters to you, and making sure that we don't cause more problems for the sake of trying to improve one thing.
All right.
We can fill in this side, okay, where you have the divot. We take some tissue from the belly. It's called a dermal fat graft. We make an incision down here. Do you have any incisions down in this area? You ever had a C-section or anything like that?
I got my gallbladder took out.
Yeah, it's not going to be in that area. So you'd be a new incision. We try and make it low enough that it doesn't show, of course. And we take a piece of skin and some fat underneath it. All right, it's an imperfect business because we don't know how much of the fat is going to live or die. If all of it lives, then it may be too big. If none of it lives, it will be too little. Dr. Morgan touches on the big factor in you. We usually do this in people that have had what's called a parotidectomy, and it's pretty straightforward because the facial nerve has not been displaced. It can be in a predictable spot. Whereas in you, the facial nerve has been displaced, and it's not predictable. And I think that there is a very real risk of damaging the facial nerve that is already working for you.
Right.
Okay? I would say you have about a 50% chance. In other words, just as good a chance that we don't damage it is that we do damage it.
Yeah, I think we do on like that other 50 over this side.
Yeah. So it's just because as you have healed, obviously tissue has come back together and it will not be in the normal places we expected. We can put what's called a nerve monitor on, but that is not completely protective, all right? It does help. I would anticipate what I would probably do is cut the old scar out and then just spread in the subcutaneous plane, trying to create a subcutaneous pocket, staying as superficial as possible, and then take a dermal fat graft and put in there. We would almost 100% have to come back and modify that graft at some point. We would probably give it about 6 months to a year to settle in, and then you're going to have a lump somewhere that you wish you didn't, or that kind of thing. Doesn't sound like it?
They don't sound like nothing to me
Okay.
that I want to hear. Sorry,
All right.
sir.
All right. Well, that's what I would have to offer. And I'm with you. I don't know whether it's the right thing. In what I do for a living, oftentimes it's not can we do it, it's should we do it.
That's right. And I
I
think you
think
said something.
that you're tuned in, and that's nice, that you're aware, and it sounds like you're very reasonable as well, which is very nice. The other option might be to fill it up with filler. And there is an option for her, because of the Allergan thing, that we could do this at minimal cost. We have a program that the company that makes fillers, have you heard of fillers? People that get their lips injected or their cheeks injected, or
All
things
that
like
fake
that.
stuff, them fake booties and all that stuff.
Kinda, yeah.
Mm-hmm.
So there's a company that makes it that's called Allergan, and they have a training program where they offer our residents free material to use to inject. Oftentimes we have some left over from the training programs, and they can use it on patients that understand that the resident is doing it, but then they don't have to charge you. It would be the kind of thing that you would put what you could get in and then wait 2 months and put what you could get in and then wait 2 months and put what you get in. It would not be something that we could match it at once. You're going to have to stretch that skin. You obviously lost a little bit of skin with the accident, so you'd have to be in and stretch and stretch and stretch until we're able to finally get enough volume there. In the meantime, the swelling under your lid is totally normal right now. It will get better. It may take 2 years for that to go down, but it will get better on its own. Putting the filler in might slow down that process. It's just because of the incision underneath. This is where this normally drains what's called lymph tissue. And when it doesn't have its normal way to get home, so to speak, it swells up. And it will get better, but it will take a long time. And you've been, what, 6 months now?
5.
5 months, yeah.
And it's done extremely well.
Well, it's going to take another probably year and a half. At least that's been my experience for the cancer patients that get various cuts under their lid. It's very sensitive. Well, Ms. Mixon, I stand ready to help. You can think through this. I am not encouraging you. I'm not selling surgery. I'm not trying to anything else. My interest is in helping you, but also in trying to predict the ups and downsides. Okay?
I'm just telling me what could happen or my options.
Yeah. And I am concerned that the use, especially that you have of your upper lid and upper eyebrow, could be compromised by the surgery. I have no way of knowing where your facial nerve is. It may be far away from where we would do surgery. It may be right there sitting in the bottom of the scar. And there's no way to know. And you can get a facial nerve monitor and you can test and cut, but still, it is not 100%.
Okay.
The other thing I would share with you is that you're a little bit early for doing anything about this. I usually like to wait a full year from the time of the injury, because scar tissue contracts for about 5 to 6 months and then it starts to relax. And we would need it as relaxed as possible in order to start trying to put something else in there. One thing you can do to help that is literally massaging this. Okay?
Rubbing it with my
Massaging
oil.
it. That's right. Rubbing it with that oil, trying to move that tissue and stretch it. Okay? Well, why don't you do that? Why don't you consider what I've talked about? Consider if you're interested at all in coming back at the 1 year point, and we can talk about this again and see how you've improved and see whether you at that point are like, yeah, this is really bugging me, I'd like to take a shot, or no, I'm pretty happy with the way things are and I can't go backwards at all, right? I mean, that's kind of the risk. There's the risk of going backwards versus going forwards.
Just let it ride. Just let it ride.
All right.
And then your theoretical time is a year anyway.
That's
so
right.
That's still.
All right. Well, we'll put it out there. If you want to come
months.
back and see me in 7 more months, I'll be happy to see you, okay?
Yes, sir.
All right. Very good. It's nice to meet you.
Nice to meet you too.
All of you.
Thank you so
I don't know
much.
how you get around with those things. I stretch my eyes out.
Okay.
Okay, you're free to go. All you need to do is up there to say, hey, I just need a follow-up in 7 months, and they'll get it scheduled for you.
It was too much too fast because I never asked. Like, didn't know.
Are these the pictures you wanted, or?
Yeah. Okay, let me take these pictures. Love y'all. Pray for me. Amen.